And welcome back on this Tuesday morning. I'm here with Lisa Hall, and we're talking about, actually, she's an author, and she's written a book, Taking Charge of Your Own Health. How are you?
Good. How are you?
I'm doing good. You know, everyone wants to know how to stay healthy, especially in the swine flu days and all the scares that we have out there. But this is a little bit deeper than just preventing flu.
Yes.
It certainly is. All right, now tell us a little bit about your story first, because you've had an illness yourself.
Yes, I have an autonomic disorder,
Okay.
and it's much better. But for a total of about 9 years, I was completely disabled, could not drive a car for 9 years, could not live a normal life, brain could not take in stimuli. I couldn't walk into a grocery store for a total of 4 years, walked with a cane or used a wheelchair. And it's mainly because it took nearly a decade to get the right diagnosis. It was the 38th doctor who finally had the answer.
Really?
And over the past 7.5 years, the medicine that he prescribed 2 medicines that I had previously tried individually, but together they were the magic formula, and I've gotten about 90% of my life back, and I love to drive now, and I can drive up to an hour, up to 60 miles an hour, but probably went 65 trying to get here all the time.
And you made it, and we've made you wait till the end of the
Yes.
show here. But let me ask you a personal question. How old are you?
47.
47.
Yes.
So that took, I mean, you're in your prime years. So being disabled and not being able to do all those things, I imagine it's very important in your life.
Yes, between my early 30s and early 40s, I just feel like I had a decade where life just literally passed me by. I watched everybody else living normal lives, doing normal things, and what should have been the most productive years just kind of passed me by. But I don't really dwell on what I've lost because I've gotten so much back by gaining it back. I have a unique perspective of somebody who lost their health, lost their life, got it back, and it's so much sweeter the second time around, and I'm so busy making up for lost time. I don't have time to dwell on those years.
That is definitely the best way to be, too. You came in here without a cane this morning, so that's all good. Now, in your book, it's almost 300 pages.
Yes.
It's going to be out toward the end of December, just in time to change your life for the new year.
Yes, great timing.
Taking Charge of Your Health, of course, is the name of it. What was so important for you to write this what is the most important thing that you think people should know about their own health?
Number one is don't take it for granted and assume responsibility and understand that, I mean, your body's like a car. Think of it like a car. You wouldn't put trash in a Ferrari. You would baby that Ferrari. Your body is one of your most valuable, if not the most valuable resource, and you don't realize how important it is until one thing goes wrong, and it can just take away your life and all the things that are so important to you. You're not able to do. So it's really the basis and the foundation. And a lot of patients are under the impression that the medical profession handles everything. And for example, a lot of patients don't know that doctors will not tell you when you're due for a screening. That is the patient's responsibility. So the book is a nice way to empower and also challenge patients to assume responsibility for their own health.
So by reading your book, are there pages in there that tell you when you should have something checked out?
Absolutely. The book includes 110 websites with helpful information, and I know there are at least 2 in there that tell you what specific diagnostic tools you need, which screenings you need, which early detection type of tools that you need based on your gender and your age.
So you are a firm believer in prevention.
Absolutely. And early detection.
And early detection. How important do you think it is we eat terribly these days.
Yes.
I mean, is that a huge factor? Was that a factor in your life?
More recently, yes. As a result of interviewing the 70 people I interviewed for the book, one physician, his comments absolutely stood out and just kind of triggered a response in me to change my life and my eating habits. He said, if you're going to promote a book on health, you've got to walk the talk. So I took some of his comments to heart, and I've lost 15 pounds since August.
Great.
And eating healthfully does not have to be a chore.
It's not miserable.
No, and it doesn't have to be expensive. It doesn't have to be time consuming. But the nice thing that I've realized is if you get all the processed foods, the sugars, the starchy carbohydrates out of your system, you don't crave it. And instead of going to the grocery store and looking at donuts thinking, oh, those look great, I look at cottage cheese and yogurt and fruit. It's like, oh, wow, that looks great. And
you actually acquire a taste for that.
And you don't need as much food, and it's not more expensive. By the time you get the better cuts of meat, as far as produce, I get a lot of frozen fruit, frozen vegetables, which are very affordable. But by the time you do that, you don't need the fast food and the restaurant food. You don't crave it. So it actually comes out a little bit less expensive.
That's probably one of our biggest downfalls too. All of the preservatives that are in our food really cause so many other problems, so many other things to go wrong with our bodies. When you're talking about, you've given me some questions here, but you talk about health care, and what about people that don't have health care? What can they do?
Health insurance?
Health insurance, right. Everyone has health care, I'm sorry, health insurance.
First thing is to find out if they're eligible for Medicaid, and that's a good starting point. Also, to get on the website of the Department of Health and Human Services, you can find out which communities have, well, most of them have federally funded healthcare clinics, which are very affordable.
Okay.
And in a larger community such as Huntsville, it's not just the federally funded, there are private communities. Like in Huntsville, we have the free clinic, the community free clinic. We have federally funded clinics. We have a new clinic that just opened up in the Tony area with reduced health care available, and those resources are available. Also working with the hospital, asking for a group rate. A lot of people don't know that if you don't have health insurance, you're billed at a higher rate because you're not billed at the group rate.
Which makes absolutely no sense to me at all.
I was floored when I uncovered that.
I mean, that is just so backwards. I never understood that one. But what should patients look for in a physician? I know that so many people do not question, if your doctor says you have to do this, don't question it, this is what you do.
Number one would be listening skills. And it's interesting because I did an online physician survey and recruited physicians nationally to give me some input and feedback. And I asked, what do you look for in a physician for yourself or your family? And number one was listening skills. The physician has to be open to listening to you, and you need to feel comfortable. You need to feel like you're a priority. Also, the physician's staff needs to be good, and the physician needs to be accessible. Coverage in the event of an emergency, that's critical. Basically, the patient needs to have a list of questions when the patient goes in to talk to the doctor. It's kind of like an interview, and those tools and several other strategies are mentioned in the book, and reference to the American Board of Medical Specialties to figure out what kind of doctor you need, what levels are, what the various white coat lengths mean. I even have a little chart, med school, the white coat length, which a lot of doctors don't wear anymore.
Right.
Is shorter than the residency, than the attending, and so there's an entire chapter on that in the book.
Okay.
And
sounds like there's just an amazing amount of information in the book. Again, where can people order the books?
Right now, it's Taking Charge of Your Own Health is available for pre-order on Amazon.com, Books A Million, Barnes & Noble, Borders, and I believe all the major retailers online. And the book will be released by Harvest House Publishers December 1st, and will be available in bookstores probably in late December.
If you know, get Sarah Palin.
Yeah, Sarah Palin's book too. Okay.
Oh,
So we'll have something in
okay.
common. If you have a loved one, this is probably a great opportunity to purchase the book for them and make a great, here's a book that can change your life for the new year. It could be a New Year's resolution too.
Absolutely.
Well, great. Well, thank you for all the information in it, and congratulations on successful health. I mean, that's important.
It's great. I'm loving it.
Good luck with your book too, Lisa. All right. Well, it is time. This has been a great Tuesday morning. You're going to have full sunshine today. It's going to be absolutely gorgeous. Temperature-wise, around 66. And also, we'll be telling you more about Tony Gooch's business. He's in the gun business, and he'll be sharing those things with you here shortly, too. We're going to take a quick, well, not a quick break, but we're out of here for today. Tomorrow, a gangster joins us, an ex-gangster, that is. We'll tell you all about that, and I'll have to ask him if I'm related to him. Anyway, have a great day today, and we'll see you tomorrow morning. Bye-bye.